In this episode of Rewind, Derek Langford, program assistant with the Wilson Center's Africa program, discusses what it will take to achieve the goal of an Africa free of AIDS, tuberculosis, and malaria.
In Africa, at present, the three most pressing diseases that have the potential to roll back hard-won development gains are HIV/AIDS, tuberculosis, and malaria. Africa remains particularly hard hit. These diseases are not unknown in other places around the world, but today African countries are grappling with HIV/AIDS, tuberculosis, and malaria. 70% of all HIV positive people live in sub-Saharan Africa. 29% of global TB cases are found in Africa as well. And the number one killer of pregnant women and children under the age of 5 in Africa is malaria. We are fortunate that there are organizations like the Global Fund that are active in fighting the big three, and important strides have been made in finally eradicating these devastating epidemics. During the past 5 years, the number of people receiving life-saving HIV treatments has increased by 200% to almost 10 million worldwide. Since the late 1990s, the cost of HIV treatment has decreased by more than 99%. In many countries supported by the Global Fund, the success rate for treating TB is close to 80%. The number of African households with bed nets has risen from just 3% in 2000 to more than 50% in 2013. And malaria deaths have decreased by 30% in the past 10 years.
The Wilson Center's Africa program, along with the organization Friends Africa, conducted a panel to analyze the effectiveness and benefits resulting from a global fund established to support the fight against AIDS, tuberculosis, and malaria.
We really welcome this event today. This is the tipping point on the fight against HIV/AIDS, tuberculosis, and malaria, and we believe that amplifying the voices of leading advocates in the fight for an African continent free of HIV/AIDS, TB, and malaria is crucial.
The Global Fund to Fight AIDS, TB, and Malaria is the biggest war chest for AIDS, TB, and malaria globally and has invested over $20 billion in over 140 countries globally. So it is the fund that has supported the fight against these three diseases the most.
Due to the flexibility of the Global Fund, again, which allows countries to implement their national strategies, we were able to use the Global Fund to effectively achieve our overall vision. Under the treatment and care, the number of HIV testing and treatment sites has increased significantly in the last 10 years, during which time 456 out of the 502 health centers have been equipped to provide comprehensive HIV services. In Rwanda, 95% of malaria cases are managed at community level. Community health workers are central to the effective functioning of our health system. For TB, we are progressing, but we still have a long way to go. The fatal results the world is seeing due to the multi-drug resistance tuberculosis are even more dreadful.
Nigeria is 170 million people. It's a large country. 1 in 4 sub-Saharan Africans is Nigerian. And therefore, with those kinds of numbers, if we are to go the whole 9 yards, we really need to look at what is happening in Nigeria and to have success there. So what Nigeria does matters. As Mrs. Kagame said, you first know where you are, where you're not doing well. We know that. We know where we are also having successes, and we're happy that we're making progress. But most important is that we have very clearly well thought out strategies for addressing each of these areas. And we know that as a country, we bear a special burden, being by far the largest, of having success.
Really, for the first time in history, we can actually see how we can end HIV, tuberculosis, and malaria as epidemics. Doesn't mean there won't be cases of the disease, but it'll be at such low levels they won't be public health threats. They won't be epidemics anymore. We've never had the ability to do that. Some people are anxious about transparency. We're not anxious about it at all. Transparency and talking about problems is how you actually solve them. You don't solve problems, you don't use money well. You don't have impact if you don't talk about your problems. And you don't talk about where money's not being used well or where money's not been spent the way it's supposed to be spent. So that new model of partnership, transparency, accountability is how we're going to actually achieve the end of the epidemics.
For more information, visit wilsoncenter.org. Click the Programs tab to find additional resources from the Africa program.